Live from the Business Radio X studio inside Renaissance Bank, the bank that specializes in understanding you. It's time for North Fulton Business Radio.
And hello again, everyone. Welcome to another edition of North Fulton Business Radio. I'm John Ray, and folks, we are broadcasting as usual from inside Renaissance Bank in beautiful Alpharetta. And if you're looking for a bank that was voted best bank in Georgia by not just one, but quite a few different surveys, one of them happens to be Money.com, Time Magazine's Money.com, Renaissance Bank is that bank. And I think they have received those high ratings from clients and customers because they are big enough to handle pretty much any need you can throw at them, but they're small enough to do it, to deliver their services in a personal way. I know that myself personally from the clients that I work with them on. If you go to renaissancebank.com, you can find their locations around the southeast, some 200 open and ready to serve you. Renaissance Bank, understanding you, member FDIC. And now I want to welcome Frank Diaz. Frank is the owner of Integrative Lymphatic Therapy. Frank, I actually said that and I didn't trip over myself. How you doing today?
Very good. How are you?
Good. Great to have you here.
Well, thank you.
Yeah, let's talk a little bit about you and your company. How you serving folks out there?
The company really started officially in June.
Okay.
And the mission is to, and I joke about this a lot, is to clean every lymph in the North Fulton area.
That's an ambitious goal.
The human body has between 700 and 600 lymph nodes.
Mm-hmm.
Now, if you look at the population of Sandy Springs, Milton, Alpharetta, Roswell, it comes out, if you multiply it, to about 13 million lymph nodes. So there's plenty to go around, and my job is to make sure I try and get as many of them as possible.
Got it. Why is that important?
It's interesting because we're taught by doctors, watch your cholesterol, your blood pressure, all of these things. But the lymphatic system really gets underrepresented when it comes to medical advice. And once you start taking a deep dive into what it is the lymphatic system does, then it becomes really apparent that, oh God, we've skipped over this. And so that was what really was the eye opener for me, was that this is as important, literally there's 1A, 1B, 1C in the human body as the circulatory system or anything else.
Yeah. So let's talk about your journey. And you worked in education for a long time, became passionate about this subject, this topic. Talk about your journey and why it's led where you are today.
Sure. I spent the last, from 1982 to 2022, working in education, higher education, corporate training, K-12. I've worked in publishing, different areas. Very fulfilling for me. I enjoyed it. I enjoy helping people. I enjoy the fact that education's one of those intangibles that no one can take from you. And so working in that and selling programs and helping people in education was a great deal for me. It brought me a great deal of enjoyment, rather. But like everything else, Father Time catches up with you, things start to change. And really COVID, when COVID hit, it changed a lot of industries, businesses, the economy, society in general. And by 2022, the education market had really started to shift. The institution where I was working at, they had, as happens, they had an administrative change. And as a result, they brought in their own team and all of that. So I was in the semi-retired stage, if you will.
Yeah.
Looking for something that has meaning for me. I started looking around. And at that time, you've met Michelle Pershing. We've had her here on the show with Dr. Rocco. And just full disclosure, she's my sister-in-law. I'm married to her sister. So that's how we're related.
Okay.
Her journey through health and wellness has been, I'm sure she was quite clear about documenting that. I served as her test subject when she was training to do lymphatic therapy.
Oh, really?
Yeah. So that's how I got turned on.
You're the patient, huh?
I prefer the test dummy part, but yeah, you're right. We joke about that one. But laying there on a table while she's training and I'm listening, obviously I've had a master's and a doctorate, so I'm good at learning things. I picked up quickly on what was going on. I sponged it up. I started researching it outside of this. This is interesting. And then at some point, I just realized education is no longer what it was. And going back to the COVID theme, it really exposed many things. And one of the big ones is there's only one person responsible for your personal health, and that's you. Okay. And I'm not saying anything bad about doctors, but if you have a broken leg, go see a doctor. If you need heart surgery, go see a doctor. But when it comes to individual health and wellness, you own that. That belongs to you.
Right.
And that was yet another thing, and I keep going back to COVID, but the folks that fared the worst were the ones that had comorbidities, overweight, diabetic, elderly, different things, some of which you can't control, the elderly part. It just happens. But you can certainly try and live a better, healthier life. And doctors, even though they try and take blood pressure meds, etc., the daily eat better and all that, that's really up to you. And so that was appealing to me. What this does, and this is how I got into this, was once I realized the importance of the lymphatic system and the role it plays in your body, immunologically, nutritionally, etc., then this whole thing just blew up in my head. And I'm like, oh, this is way bigger than just wearing compression stockings or I'll have some swelling. This is much deeper than just and that's what really put the hook in me. And I did a nice head first deep dive into it. And it just went about the usual way of starting a business and getting a business license and all of that stuff. And that's where I ended up today.
Yeah.
So
it's
an interesting, journey.
Yeah, that's a great story. So I want to get real basic for people like that are in our audience, and folks, no offense, I'm the same way. I'm learning here. What is the lymphatic system? Let's get real basic, right?
Sure. Lymphatic system, if you want to put it in real simple terms, is the body's, it's a combination of, but it's mostly the body's sewer system. It clears out all of the waste and toxins and things the same way your blood delivers oxygen and takes out the carbon monoxide and that sort of thing. What this does is multiple levels. First of all, it's responsible for your immunological system. It produces and delivers white blood cells to combat infection coming out of the bone marrow and spleen. That's where that comes from.
Okay.
It delivers nutrients. You take all those, if you have those protein shakes and amino acids and different things, it's responsible for delivering the good stuff. And then it also takes away the bad stuff, the toxins, the things you no longer need, and not just in your body, but in your brain and in all parts. And it also helps reduce inflammation. It helps when you have infections. So if you've ever noticed when you get a cold or whatever, you get the swollen lymph nodes in your throat and stuff, that's where a lot of the infection collects in there until it gets processed out. You can massage it out manually or put a hot compress on it or whatever, but those are the real outward signs that you would notice as a person as to what the lymphatic system might be doing. It runs parallel, if you want to look at it, like on top of the circulatory system. The only difference is the circulatory system uses the heart to pump the blood. The lymphatic system uses your body's movement to move fluid through. So that's the key, and you're nodding your head. Yep. So
don't take that as I know what you just said, but but I'm with you. Yeah,
you get it.
Yeah.
And simply put, you are the pump.
Yeah.
So the more active you are, the more fluid you move. And if you've got
Interesting.
If you look at folks that are my father was a carpenter, so he was in great shape up until he's thin, fit, and running around. A lot of these construction guys or different people that are very active and moving around, not a problem. But most of us, myself included, we live in front of a computer screen.
Right.
That's how you make your money. That's how you work, and that's what you do. That sedentary lifestyle, even if you go to the gym and you work out and you do things, which is a nice balance, you're still sitting a lot. And I last week there was an article in the New York Post that said that sitting is now considered the new smoking, which you think about that one like, oh, okay. But yeah, we are sedentary. And the more technologically advanced we become, the less we physically have to do. And I can tell you from having two teenage sons, they just sit there and game all day. I'm like, do you guys ever even go out? Or they don't. Whereas when, let's say you and I were kids, you were out. There was nothing else to do. And so that sedentary lifestyle poor diet,
Mm-hmm.
I guess over medication for different things, and just a series of other things. They've all kind of contributed to creating this situation where you get, I don't know, lymphedema, or the folks with the swollen legs and the ankles. And it doesn't have to be very, I guess, chronic or acute, like with folks with the really swollen legs or whatever. It can be very subtle swelling.
Mm-hmm.
My wife's a retired school teacher.
Right.
Being on your feet all day,
Mm-hmm.
that causes it. So there's different things like that.
Yeah. So what when we think about a sedentary lifestyle, we think that is a issue around exercise, muscle mass, and then leading to, let's say, heart and lungs and that part of our system, right?
Mm-hmm.
What you're introducing here is something that's I'd be willing to bet's news to a lot of people, that there's a whole nother aspect to their body that benefits from active movement.
Oh, definitely. It's the implicit part of you need daily exercise. Again, the focus has primarily been on your cardiac system and your breathing and
Right.
and of course that helps with blood pressure and all of these things, which are perfectly fine and legitimate.
Sure.
It's part of the bigger picture, but it's the unspoken part. Okay, the only time it really becomes out there, like it's known, is when you do have a lymphedema or you have some other condition. Let's say you've had lymphedema or any kind of edema, which is fluid in the body from if you had a mastectomy or if you've had any kind of lymph nodes removed or anything like that. Then sure, yeah, you have to get manual drainage and you have to do these things. Otherwise, no one really talks about it.
Mm-hmm.
And so you talk about the immune system, but you don't talk about the mechanics, the specifics of it, because some of it is a little too granular.
Right.
But I think that once a person, because that's how it worked for me, once I was able to visualize, like, oh, this is how it works, then everything fell into place.
Yeah. Yeah. Frank Diaz is with us, folks. He is with Integrative Lymphatic Therapy. That's his business. Okay, so we've talked about what the problem is, and well, maybe there's one more. Maybe we need to extend that a little bit. Come to think of it, when we have this lack of movement, and we have what you're saying is that we don't have fluids moving throughout our body that clear the lymphatic system, right, of the sewer stuff, as it will, right? That's what we're talking about.
Correct.
Okay. What's the impact of that? What does that look like at its extreme when you run into patients that have a significant problem? What does this lead to?
It's a couple of things. And obviously the first part you brought up is the initial problem is that you can't move the fluid out. And just like anything else, when a sewer system backs up, it's because there's either been too much rain, it has nowhere to drain, etc. The way the lymphatic system is set up, when your body, your tissues, that interstitial fluid builds up, that pressure pushes fluid into the lymphatic system. And then the lymphatic ducts, they have the veins and the arteries have little valves that keep the backflow from coming. But if it's not moving, it can't take on any more fluid. And so what happens is that if you've got bad stuff, it piles up. But the part that's even worse is because it's backed up, it's not able to deliver, because it's a closed system. It's not able to deliver the good stuff. So you might be taking vitamins and supplements and different things, but they're not getting to you because they can't. So it's a two-way traffic jam if you want to look at it that way.
Yeah. Yeah. What are the symptoms that let's put it like this. I'm assuming we're talking about middle-aged and seasoned citizens, right? That's because this happens over a period of years. That's where you see most of the issues.
Outside of medical conditions, cancer, surgery, etc. I would say 40 to 50 plus.
Yeah, got it. So what are the symptoms I need to be looking for that say, hey, I've got a lymphatic issue?
Swelling, any kind of swelling, inflammation, swollen joints. I use the line, inflammation is not your friend. And inflammation is a sign. It's the body's way of poking you and saying, hey, you got a problem here, your elbow, your knee, that sort of thing. But it's not normally, or not totally, I should say, limited to joints. It could be stomach bloating, or just your skin's feeling weird, or on your feet, you would notice it. If you've been on your feet too long, or you've been walking around, your feet feel thick. You can't really bend them. They feel funny. And you take your shoes off, you're like, oh, that kind of thing. And you would notice something like that. And other sub issues would be you're feeling tired. You're not your usual self. You get sick. And by sick, you get a lot of colds and different things. There's no one specific thing. There's really a bunch of different things, big, little things that either are individual or combined that can cause you. But it's not hard to see. And it's certainly as once you're over 20, the warranty starts ticking.
Yeah.
And you start running out of it. And those are the things that you need to be aware of. Same as you watch your diet, your blood pressure, and your alcohol intake, different things. This is just, you have to listen to your body.
So I guess what's Frank, the tipping point between when people need to come see you? When do they know that they need to come see you, as opposed to just, I've got the usual middle-aged lack of mobility and I need to get out more and move around a little bit? But when does it get more serious? And when do they need to come see you? Unfortunately,
like with everything, a doctor will tell you, hey, I've noticed this, your blood work shows that, or let's say you happen to have you're having knee pains. Right? They do an MRI, which is a typical thing. And they say, oh yeah, by the way, you have edema. You have swelling, and it's not water on the knee. They suck it. This is everything swollen. The leg is swollen. And it may be subtle enough where you don't really see it. It just feels a little uncomfortable. You attribute it to, oh, it's just really hot, or it's things like that really start to ring the bell. And also, if you are type 2 diabetic, you have an issue with weight. You're carrying more weight than you normally should. I remember my mother had high blood pressure, so she couldn't eat anything that had a lot of salt in it. Salt makes you retain different things like that. There's a point where you start to realize, and that's the thing, you must pay attention to your body.
Yeah, all that makes perfect sense. So when you have someone that comes to you, how does that conversation go? How do you diagnose what needs to happen?
Fortunately, these folks are aware, for the most part, that they have an issue. They either have been diagnosed officially with lymphedema, or they have edema from post-surgery or whatever, or they've developed lymphedema from something else. When they come in, I get a full medical breakdown, because they've obviously been in medical care at some point, or for some time, I should say, where they can say, oh, my doctor said this. And you're like, oh, they fill out an intake form where they list any ailments, issues, conditions, medications, and all of those put together with their story and some medical history. We can figure it out. And it's actually, in a way, it's because it is very specialized or granular, you know exactly what you're working on. And so they come in and say, oh, I've got this, my right leg is obviously bigger than the left leg or the arm or whatever. But what happened? I had surgery. Okay. And you can figure out a treatment plan for that pretty quickly. And in this particular case, what separates what I do from traditional manual lymphatic therapy is just that. It is not manual. It is not hands-on type therapy that I do. And just for some background, if you have lymphedema, let's say you have an extreme case, or something called lipedema, and that's folks that you've seen with very large arms and legs. There's a surgery center just across from where my office is in Roswell, where they do lipedema surgery, and they use something called hydroliposuction. Liposuction is the vacuum cleaner. This is basically a cross between a vacuum cleaner and a pressure washer. They use water to clear it out, and once they clear everything, they sew you up. And then you need post-care massage. And what they'll do with that and other things, they use compression garments. They'll wrap you up like a mummy. But it's not just like we wrap an ace bandage. There's a lacing process. It's very prescriptive. It's very specific. It's also very painful and uncomfortable. Not so much for the lymphedema patients, but I have been working with, I guess it's a parallel niche market of post-operative liposuction, tummy tuck, mommy makeover, that kind of thing in the torso.
Mm-hmm.
And real quick, what those are is they'll take your stomach muscles, after women particularly have children, they sew them back together like you would lace a shoe or a corset. You just lace the muscle back together. Big scar that goes from side to side. Get up under there, fix it. They have to, post-operative for a couple of months or more, they have to have drainage because the body makes fluid. It's, the body's in shock because of what you've done to it. So you have to drain the fluid. They have drains too. Manual massage is painful.
Yeah.
They don't like that. They get it right after the surgery, but once people do this, oh, wow, this is pretty comfortable. And I think that the convenience of it, the lack of really discomfort because it's just a glass tube sliding over your body, and the fact that there is no ouch factor makes it convenient. Your typical manual drainage between the wrapping and the massaging is anywhere from 2 to 3 hours. 1 hour of this assisted lymphatic therapy is like equivalent to 6 to 7 of those. So you can knock out in 1 hour what you would do in 18 hours or whatever of those, just because it's that much quicker. The technology, the way it's set up is it'll penetrate up to 8 inches into your body and move things. And there's a whole, I can explain how the mechanism works, but yeah, that's the long and the short of it, is that it is a much more efficient, I call it the next generation, the disruptor of that, the next iteration up.
Wow. Interesting. Frank, I would love it if you maybe could share a success story, one that helps illustrate the great work you do.
Sure. There's a gentleman. He's a 74-year-old male. He suffered a carotid artery aneurysm, like a brain. He had a stroke essentially, but it wasn't so much in his head; it was in his neck. And the end result was he has paralysis on his left side because it happened on his left side. So he has limited movement in his arm and leg, but it's because the muscle's just really tight. And he can't move it. They implanted a pump about the size of a tuna can in him, and it has a catheter that goes into one of his vertebrae, and it delivers a constant stream of muscle relaxant. And what that does, it allows the body to move. And this gentleman is in great shape. For a 74-year-old man, he goes to the gym. He's very dedicated to maintaining his health, but he can't move sometimes. Yeah. They're still tweaking how much of this and how much, but so he comes to see me because his leg was starting to swell from lack of movement. And so I worked on it, and the normal treatment is full body. In this case, again, going back to specifics, he needed that leg to get back in shape. So I just worked on that leg, opened up the normal ports, the axillaries and all of this, and just spent the rest of the hour just clearing the front and back of the leg and trying to get it up his side of his body, trying to get that fluid to move.
Right.
And he's been in there 3 or 4 different times, still working on him. But he experienced relief. I mean, it wasn't miraculous overnight, but he noticed the difference. And then with each session, it's almost like we're retraining the body, the lymphatic system, to move that fluid out, which is part of what it is.
Right.
So to me, that's been my big success, because the other folks, the tummy tuck, the cosmetic surgery folks, younger folks, and this is a little different. This gentleman he checks off every box for, okay, this is someone that really needs the treatment. Yeah,
that's terrific. Terrific work. Frank Diaz, folks, with Integrative Lymphatic Therapy. Frank, this has been great. I can't imagine there aren't some folks that want to be in touch. So let's tell them how they can do that.
Absolutely. They can go to www.detoxlymph.com, and that's DETOXLYMPH.com. My email address is frank.diaz, and that's DIAZ, at detoxlymph.com. My office is in Roswell, right there on Crossville and Crabapple. And just go to the website. You can book your appointments there. There's a lot of information on there. I'm still developing the website. I'm going to try and put some more literature out there, some more medical links and different things like that. And having been in education for so long, one of the things, you do scholarly stuff and papers and things. One of the things I've noticed in trying to, dive deeper into this is there really isn't a lot of medical studies, case studies on the use of assisted lymphatic therapy as a treatment for lymphedema as opposed to manual. Only found a couple of them. One of the things I want to really do and want to accomplish is to maybe not necessarily do a full peer review study, but case studies like this gentleman. So yeah, absolutely.
Terrific. Frank Diaz with Integrative Lymphatic Therapy. Frank, this has been great. Thank you so much for sharing your work, and congratulations on that work.
Thank you, sir. Thank you for having me. Appreciate
Absolutely. My pleasure. Hey, folks, just a couple of quick things. One is I have a book out. It's called The Generosity Mindset, a journey to business success by raising your confidence, value, and prices. If you're a professional services provider, you got a solo or small firm, and you're interested in improving your pricing and business development, this may be a book for you. So if you want more information on that, you can go to thegenerositymindset.com. Also, I just want to thank you, our listener. This is show number 726 for North Fulton Business Radio, and we've only gotten this far because of you. And one of the things that you do, among many, is share the show. So if you heard something here that makes you think, hey, I know someone that needs to hear about Frank Diaz and the work he does, or any of us, our other 725 shows, please continue to do that. It helps us shine the light on great business leaders in the North Fulton area and celebrate and highlight their work. And you help us live into our mission to be the voice of business in the North Fulton region. So for my guest, Frank Diaz, I'm John Ray. Join us next time here on North Fulton Business Radio.